Thanks for taking the time to educate yourself about Empower Healthcare's occupational therapy services. This video will tell you about the scope of our practice and the unique value of each service area and when it is appropriate to refer to our services. At Empower, our occupational therapists work with people aged 15 and over, supporting a wide range of needs, from physical and neurological conditions to mental health challenges or age-related changes. But at the heart of everything we do is a strong client-centered focus. Our role is not just about helping people manage their conditions, but about being able to help them live well with purpose, safety, and independence. We take a wellness and reablement approach, which means we focus on what individuals can do, what's meaningful to them, and how we can support them to regain or build those skills and routines. Our OTs will support collaborative goal setting and implement goal-directed support. This may be through a range of OT tools and skills such as assistive technology, reviewing the home or community environment, exploring skills and strategies to build somebody's capacity, and exploring evidence-based strategies to support daily functioning. Ultimately, our goal as OTs is to empower individuals to do more of what's meaningful to them, whether that's making a cup of tea, applying for a job, or using public transport, or simply feeling confident and capable in their own space. We don't just ask, what's the matter? We ask, what's the matter? What matters to you? And we work alongside people to get them there. So what does an occupational therapy assessment involve? So when there's a mismatch or barrier in any one area, it affects somebody's occupational performance. The OT's role is to assist to identify these barriers and create a personalised plan to support the person. This can include building the person's skills, looking at different ways to do a task by implementing capacity building strategies, modifying the environment to support accessibility and safety, assessing, trialling and prescribing equipment and assistive technology, and building the capacity of the person's support network, including family, friends, neighbours or formal support workers. This holistic, client-centred approach helps people overcome challenges and participate more fully in the activities that matter most to them. There are many signs that someone might benefit from an occupational therapy assessment, especially when support is needed to maintain safety, independence, and quality of life at home or in the community. I'm going to go through some examples of when an occupational therapy referral might be indicated. So one of the most common indicators we see is when a person is experiencing more frequent falls or is starting to feel unsteady on their feet. This might be indoors, when getting in and out of bed, or even when navigating their own home. This can really impact a person's confidence and increase the risk of injury. We also see referrals when someone is finding it harder to manage their everyday tasks, such as getting dressed, preparing meals, or maintaining personal hygiene. These are essential activities that contribute to independence, and when they become challenging, it can be very frustrating and isolating. If someone is experiencing some changes in their memory, thinking, or ability to organize their daily routines, this can also be a signal that someone might benefit from occupational therapy input. We can help by introducing strategies, tools, or environmental changes to support cognition and routine. Another indicator is when a person or their loved ones express concerns about safety at home or in the community. So maybe they are no longer confident going out. These fears are valid, and OTs can assess for solutions to help rebuild that confidence. Some people find that they are struggling to physically access parts of their home. So for instance, they might not be able to reach the kitchen safely or use the bathroom without help. In these cases, occupational therapists can recommend environmental changes or equipment to improve access and function. We are also commonly involved in supporting people after a stroke or neurological event, helping them regain the skills and confidence they need to participate in their daily life. When someone is spending prolonged periods in bed or in a chair, they may be at risk of skin breakdown or pressure injuries. OTs can provide advice around positioning, equipment, and routines to reduce these risks, working collaboratively with their nurse or general practitioner. Sometimes even simple aids or modifications can make a huge difference, reducing physical strain, improving safety, and allowing a person to maintain more independence in their daily routine. OTs can support with completing a functional assessment to support care planning, service delivery, or funding applications, ensuring that they're receiving the right level of support based on their needs. And finally, many individuals want to stay in their own home as they age. OTs can assess and recommend changes to help make that happen safely and comfortably. This is often referred to as aging in place. In all these situations that I've just described, OTs can make a meaningful difference in someone's ability to live the life they choose with dignity, safety, and confidence. These are just some of the many areas that OTs can support with. What does an OT assessment involve? Our occupational therapists will meet with the person in their home and community to understand their unique circumstances, goals, strengths, and the challenges they face. The assessment starts with getting to know the person, so discussing their goals, what their daily routine looks like, and what's important to them. We take a holistic view, not just focusing on their diagnosis or their challenges, but looking at the full picture of their life. To guide this process, we use a framework which is called the Person, Environment, Occupation model. Each of these elements play a vital role in how someone functions day to day. So I'll just explain this model. So first of all, you have the person, and this includes their strengths, their physical and mental health, their skills, their values, their motivation, and their personal preferences. Then you have the environment, which refers to the spaces they live, work, or move through, like their home, school, workplace, or community, as well as the social and cultural context around them. Then you have occupation, which refers to the meaningful activities they want or need to do, such as showering, cooking, going to work, participating in hobbies, or socializing. And then at the center of the model is occupational performance. And this is the actual ability to do those meaningful activities. It's where the person, their environment, and the occupation all come together. When those three elements are well aligned, a person can function effectively and independently. But when there's a mismatch, say the home environment is inaccessible or the person's strength or memory has changed, that's where challenges arise. An OT assessment begins with getting to know the person from a holistic perspective. Our occupational therapy therapists within Empower are trained to administer a program called the COPE Dementia Program. And that is a program which aims to support both individuals living with dementia and their caregivers. So dementia affects each person uniquely, and our approach is centered around the person's individual needs and their strengths. So whether the person is living at home, noticing changes in their abilities, or it's a caregiver seeking guidance and support. The COPE program offers tailored strategies to enhance daily living. Our occupational therapists and team provides education, training and assessments to ensure a safe and supportive environment. We focus on what you can do. We aim to empower you and your loved ones to face the challenges of dementia with confidence and dignity. So COPE delivers a multi-session intervention which consists of 3 phases. So first of all, we have the assessment phase, then the intervention, and then the generalization phase. The program will be implemented by a COPE trained occupational therapist. The assessment phase includes the occupational therapist identifying the roles, habits, interests, abilities, and also the carer's concerns. The intervention phase includes the OT training, the carer to modify the home environment, the daily activities and communication to support the person's capabilities, using problem solving and also to help lower carer stress. The generalization phase includes working with the carer to be able to develop strategies in the future if it's needed. So the interventions with COPE include carer education, training, home safety assessment, and for people that live in Victoria, it also includes a nurse screening assessment. The COPE program, it's a time-limited reablement initiative designed to support both individuals living with dementia and their caregivers. It is also delivered in-home or online, and the program focuses on enhancing well-being by building on individual strengths and providing practical strategies to navigate daily challenges. So our referral process, referrals can be easily submitted through our website. Once we receive the referral, our community support team will send an acknowledgement email, which includes the number of hours required for the occupational therapy initial assessment. And because each individual needs are different, the level of support varies from person to person. That's why before or after the initial assessment, our OT will connect with you directly to discuss what ongoing support may be needed. This could include additional sessions focused on capacity building, strategy implementation, assistive technology, equipment trials, or even consultations with builders, whatever best supports the person to achieve their goals. This process ensures that the care we provide is not only comprehensive, but also uniquely tailored to each person. It's all about delivering true client-centered care. Thank you.